I'll
Yes.
just start. I want to start in the beginning of this MOU. I'm going to just quickly scroll to the bottom so that you can see that there are a lot of different sections to this MOU. We start with the preamble and the purpose of the MOU. We talk about teaching hours. We talk about planning and meetings. I know you've all seen a copy of this, but we're going to go through it line by line. Guarantees for staff. We've got teacher evaluations, substitutes. There's a lot of different topics in here. So you can see at the bottom that it was signed by Terry and Dr. Anderson on the 31st, which was last Saturday. Actually, they got together, I think, in a socially distanced signing party and signed the MOU. So the MOU is in partnership between BVSD and BVEA. The preamble on this, the majority of this comes right from our preamble in our contract, which says Boulder Valley Education, BVEA, and the employees of BVSD recognize and declare it is our mutual aim to provide a quality education to all pupils of the district. We're classroom educators and want to be in our classrooms educating students under the safest possible conditions. And this is an important statement. The parties realize that we will not eradicate all unsafe conditions. That's very important. We're not going to get to the point where we can't we can make everything safe, but we're going to do our best. The purpose of the MOU sets forth the terms between BVSD and BVEA to address concerns that have arisen from the COVID-19 pandemic. These next two caveats are in here because we wanted to make sure that people understood we are not replacing any contract language, we are simply supplementing it, and that we will be doing shared decision making in the absence of directives right from the Boulder County and Broomfield County Health Departments. So unless otherwise noted, the provisions of BVEA and the BVSD Master Agreement remain in effect, subject to the modifications listed in specific sections and articles below. Absent contravening guidance or directives from our local health departments, shared decision-making and/or consultation with building administration will be employed. Teaching hours and teaching load. This is right from contract language, particularly the first dot that is on here, the open dot. Referring to contract language C-5, Article C, at least a 30-minute guaranteed daily duty-free lunch period will be ensured. In the interest of minimizing cross-contamination and contact tracing, it is highly recommended that employees remain on campus for the entirety of the workday. Employees will be provided an additional 15-minute break if not afforded daily planning time in any of the in-person phases. Terry, do we want to answer questions in the chat as we go?
Yes. Sorry. Yeah. Yes, we should. And the question I'm seeing is from Barb Watson, and it said, how did we arrive at the statement, sorry, I had to admit somebody, in the preamble that we realize that we will not eradicate all unsafe conditions? Doesn't that leave us open to agreeing to unsafe conditions by default? And I'm going to open that to anyone who is involved in this if they would like to answer that. Perhaps we'll let John tackle that one.
Well, I think within the document, there's a distinction that's drawn between mitigating risk and eliminating risk. There's obviously a contingent of BVEA membership who understandably have concerns about any risk that can be assumed through the resumption of in-person teaching. The team and the district were cognizant of the fact that risk cannot be completely eliminated. The only way you can eliminate it is basically by staying at home 100% of the time. All of the phases that aren't phase one have some element of in-person interaction. With in-person interaction comes risk. And so I wouldn't qualify or classify the preamble as how can I say it, giving ground on the issue of risk management. I think it's just an acknowledgement that whatever we do, that it can't be 100% effective in the way that we might hope.
Thank you, John. Another question has to do with the 15-minute break. So it was not quite understanding about the 15-minute additional break. And then also a question about how does it work at the middle and high school level when a teacher has no plan on a block day? I'll let Patty, do you want to talk about that one a little bit?
Sure. So the way I see it, this guarantees if you do not have any single break other than your 30-minute lunchtime, that you would get an additional 15-minute break. And what we're hoping is that at each building level, according to your schedule, once you're in the building, you know, there will be a person, if you do not have a break at all, more than 30 minutes, that you would be able to have someone come to your room for you to take a break. Now, you know, I know in high school when I worked as Antares, you know, my lunch period was more than 30 minutes. So if your lunch period is more than 30 minutes, and that's taken care of. So I'm not familiar with every single schedule at every single school, but if the only thing you get is 30 minutes, then we're hoping that at each building level, there will be that 15-minute break that can be, you know, maybe a paraeducator can come in, or, you know, that needs to be decided. There are a lot of things that are going to have to be decided through shared decision-making at each building. So, you know, like I said, I know in high school I got a 50-minute break because that's how long the periods were. And it just also all depends on how the periods are going to look once we get back. But our hope is that if it can, you know, if through the FAC at each building, this can be settled through a schedule. If you do not get more than 30 minutes, then, you know, if that cannot be accomplished, we'll be more than happy to work through it with you.
Okay, so, and then there was a question about adding days to the school year. Someone was concerned that we could add extra days and what would cause that to occur if we are still giving instruction online. Probably that wouldn't occur if we stay in a phase 1 scenario through the year. I think the district's goal with this task force is to try to get some small groups back in some form or fashion. I have no clue what that will look like. That'll be work of the task force. So what are the reasons we might have to add days? I guess if we, you know, it's just like when we have snow days, if we miss too many days, we have to add days. You know, when we went to the home learning last year, we had those 6 days before spring break, and CDE has requirements for the number of days and minutes or hours that students have to be in school, and they just kind of forgave that last year. So I guess if there was some reason that we missed a great deal of instruction time and had to add days, that's what, so I don't have any specifics. Maybe someone else who helped negotiate the MOU can add more clarity.
Terry, I know that we have 4 days built into our schedule for snow days already. So if we go beyond 4 days, there might be an issue, but I really think that we of course had to put this in here about adding additional days, and that's kind of further down in the document. But we didn't want to be taken by surprise and have anybody say to us, we're adding days to your calendar, and there's not a whole lot that can be done about that. We want to be able to negotiate it if that happens to us.
Thank you, Nancy. And then question wondering if the MOU only applies to in-person learning. No, this MOU applies to all phases. That's why we wrote it broadly, because even when we were writing this MOU last week, we were still thinking it was some version of phase 3. So this applies to all phases. Okay.
Okay, I'm going to go on.
And yeah, I'm just going to answer. When phase 3 is announced, I don't know if there'll be a time frame. I don't think there will be. I think it's uncertain at this point how long phase 1 will be the phase that we're operating in. Okay. Go ahead, Nancy.
Okay. Planning and meetings, and this is right out of our contract. Referring to contract language C-5.1, a minimum of 4.5 hours of duty-free planning time will be provided per week. Every reasonable effort will be made to provide planning periods of meaningful length of 30 minutes. We talked a lot about the Mondays that we are not in school and that we are expected to do the majority of our planning on Mondays. Well, there are some Mondays in the calendar that are non-student contact days, and we wanted to make sure that we covered those days for us with no meetings or staffings or any kind of professional development on those days. So Labor Day, Martin Luther King Day, and President's Day are the 3 Mondays that we have no contact with students. Labor Day planning is compensated the week prior due to the delay in the student start date. MLK and President's Day planning will be substituted the Monday prior to both of these holidays. Specifically, January 11th, which will cover MLK Day, which is on January 18th, and February 8th, which covers President's Day, because President's Day is January 15th. Those will be entire days for teacher-directed plan time. Referring to contract language C-5, the work week will be 40 hours per week, including 2.5 hours of individual teacher-directed time. Again, that's right out of our contract. BVSD and BVEA recognize that the pandemic has created conditions that may necessitate meetings beyond the standard contractual maximum of 60 minutes per week, as well as a need for additional teacher planning and preparation time. Every effort will be made by both parties to collaborate in allocating and apportioning planning and non-teaching time to meet the needs of both teachers and administrators. There will be a site-based shared decision-making process used to determine virtual versus in-building planning, PD, and meeting time. I know one of the questions we've gotten a lot about that last bullet in particular is, if I am on a medical exemption and my principal is calling a meeting at my building, do I have to go to that meeting at my building? And the answer to that is no, you do not. You stay virtual, and the principal is then tasked with how to get you involved in the meeting via Zoom or Google Meets. So you don't have to go to your building for PD, meeting, or planning times.
Nancy, another question, somebody was wondering if we're in phase 1 about the planning on Mondays, but that will continue. Phase 1, I was told, will still have the all-day planning and meeting time on Mondays. So students will be given work to do. I don't know, that'll be something that's sussed out with the district and at buildings, but yes, Monday will be a non-student contact day. And then there was another question. I'm sorry, go back a little bit. Sorry. Oh, consistency between buildings. Yes, I understand there's going to be a high level of district expectations for educators that has everything to do with grading and taking attendance and teaching. So I think that's a document that's going to be perhaps shared at the board meeting today that would allow for consistency among buildings, because I know that was a concern last year. There just wasn't a lot of consistency. Okay. I think that's it for, so question about the MLK and President's Day. How does one Monday cover another Monday? Do you want to explain that, Nancy, a little more?
Yes, because there is absolutely no school at all on those days. There is no, like, teachers are not supposed to be in school. students are not in school. We wanted to make sure that we didn't lose the planning for that upcoming week on a Monday. So with the week prior to that, January 11th and February 8th, we will have full days of planning. There will be no meetings scheduled for those days, no staffings for those days, no PD for those days. Does that make sense?
I think, let me try to clarify. So on the Mondays, I don't want people to misunderstand. When we have Monday plannings, the 4 or 4.5 hours for that Monday, the rest of that Monday can be faculty meetings, staffings, etc. So it's not the whole day. So what we're saying is that on those specific Mondays listed in the MOU, it will be the whole day for planning, no meetings, no anything extra. I hope that clarifies it.
Okay, and there's a question that those are 9 hours of planning. Maybe not 9 hours. Although I'm sure most of us did more than 9 hours of planning on lots of Mondays and other days too. But if they will be full, complete days, there will be no anything those days other than just planning. No one can ask you to attend a meeting. And Patty is right. Staffings are right now recommended by special education to be on Mondays. That's not a requirement. You can't make every parent come to a meeting on a Monday, but those are recommended days for staffings. These particular Mondays would have none of that though.
There is a question about specials at elementaries. Will this continue in phase 3? I don't know. I don't even know if we're going to be able to have phase 3 the entire school year, considering how many medical exemptions we have. So that answer is to be determined. We just don't know at this point. So Paul, specials and elective teachers have not been given any info. So the roles will not be written in this MOU. This is more of a general MOU. I would assume those roles are going to be further defined. It might be by the task force. It'd probably be working, the district's going to be doing that in conjunction with schools. I just don't have a good answer for that, but it won't be in this MOU.
Paul, I would say though that we did ask that specials teachers be included in that task force.
Yes, and they certainly will be.
Someone could possibly do a double role, be an elementary person and a PE teacher, or middle school person and an art teacher, so that specials are absolutely covered on the task force. Okay, additional days to the contract year. We've kind of already talked about this. For the 2021 school year only, if there is a need due to the COVID-19 pandemic to add additional days to the contract year, the parties will convene to discuss pay and conditions related to any additional days.
I don't know.
I'm sorry, go ahead, Terry.
I apologize. A question about, will the task force be meeting virtually? I don't know the answer to that, but my assumption would be if we're in a phase 1, that they will be virtual meetings. That's all that would be my assumption.
Okay, guarantees for staff. Any non-probationary employee who fulfills a temporary role other than their current assignment or who has a medical exemption during this time shall be guaranteed the right to return to their previous position unless the employee voluntarily accepts another position. Do we want to go through these one by one? Because these are some interesting statements. They are statements that people have a lot of difficulty understanding. So are there any questions about the first bullet? What I would say about that first bullet is that if you are a probationary person, the same rules would apply for you as any other time. Our contract covers those. Same thing for non-probationary, actually. Okay, I'm going to go on. Educators working remotely shall receive adequate curriculum support and resources in order to ensure equitable experiences for students who opt in to remote learning. Some of you here in this call, I know, have been on committees, et cetera, this summer, writing units and coming up with videos that are appropriate and that sort of thing. That's some of the things, some of the work that we're referring to right here in this bullet.
Nancy,
Educators, go ahead, Patty or Terry.
Where are we at, Nancy? I've been trying to read the chat. Are we still in, okay.
We're
why
right
don't you
here
go
in the
finish
third
that,
bullet.
and then I'll chime in before we get to safety protocols.
That's okay. We're right here on the third bullet, educators working remotely.
Okay, go ahead and finish this section.
Okay. Educators working remotely shall be granted the same caseload or class size protections as those teaching in person. Every effort will be made to keep those teachers on medical exemption involved with teaching online at their home school. And I want to stop there and talk about that a little bit along with this next bullet. Based on need, educators may be required to teach in another teaching assignment or in another school. The fact that we have 300 teachers now that we know of who have been approved for medical exemption tells us that all 300 of those teachers may not be needed in their home school, because we also have a lot of students who have opted for online learning. We don't know the numbers for those. I know I read Randy Barber made a statement that they should have those numbers put together by this afternoon for the board meeting. So I'm anxious to hear what those numbers are. Obviously, if the students are not there in your building, or they have opted for Boulder Universal, then some of us may be asked to teach at Boulder Universal or to do online learning through Boulder Universal. And in that case, we looked at the language that Boulder Universal has and the language in our contract, and it is basically the same. It would be about 30 students, I think, something like that for elementary, and about 150 or so for high school, secondary. Okay, next one. Educators quarantined due to exposure to COVID-19 will be expected to assume online teaching duties if their health conditions allow. The health conditions allowing is determined by the teacher. If the teacher says, yes, I feel well enough to teach online, then you will be teaching online instead of using sick days. So we wanted to make sure that we put that in here. Staff members will be provided with personal protective equipment, or EPG as the district has referred to it, essential protective gear. At a minimum, this equipment will meet health department guidelines. For employees whose need or assignment requires equipment in excess of what the standard issued EPG includes, BVSD is committed to providing that specialized equipment. Okay, Terry, I'll stop there and answer questions.
Okay. So somebody asked when principals would get the MOU. I don't know, and I wrote that down. I will ask Dr. Anderson and find out when that's going to, or one of the area soups, I'll find out if they've been given it or when that's going to happen. So, about parents changing their minds about from BU to their school building, probably. I don't know for sure. I know the district had wanted parents to make a commitment by, I think it was a week ago Friday, but I'm guessing that there's going to be quite a bit of flexibility now that we're announcing phase 1 at the board meeting today. Yeah, so I'm just assuming. I don't know for sure. Hold on. Is everyone going to receive curriculum support? That is my understanding. And will phase 1, will this year count toward probationary evaluation? Yes, I believe it will. It's just that you saw in that email I sent Sunday that we aren't going to have to deal with measures of student learning this year. That's been put off by CDE. but we will just be dealing with the normal professional practices section. And God knows what that's going to look like. So we'll be closely monitoring that. Okay, what else?
Terry,
Oh.
there was a question about why only 15 teachers in the task force. Can you address
Yeah, do you want to
that?
answer that, Patty?
Sure. So, you know, we had a lot of conversation about that, and when a group gets, it's not just teachers in this task force, obviously. We have teachers, we have administration, you know, department heads, and we also have community members. Example, DAC, the District Accountability Committee, is going to be part of this as well. So trying to get as many voices in the room. And when the group gets, you know, to be a certain number of people, it will be very difficult to be effective and have decisions made. So what we've committed to is, you know, what the conversations were 15 educators and then 15 administrators, and they have taken some of their slots, for example, for DAC or community. There will be consultants coming in, as I understand, like if there is, for example, Boulder Public Health there's some questions that have to be addressed through them. Can this or that be done? Remember, this is a task force that's going to come up with 2.5. So not completely redoing all the work that has been done, but what are, I'm assuming, the best parts of what we can take in order at what point we come back with 2.5 back to the buildings in some way, shape, or form. So we are starting in phase 1. How long is it going to take to the 2.5? That is the unknown, like a lot of things are. But, you know, we worked really hard, and I really think, you know, we are going to make sure every single level is represented, as well as every possible area, right? For example, you know, if we have elementary, you know, hopefully counselor, hopefully, you know, specials and SPED and all these numbers. So we're really going to really work hard to have, and yes, bilingual schools, and you all know that's deep in my heart, and we make sure that that also will be represented. So I just wanted to clarify the reason the number is because it's not just these 15 people plus other 15, so that's 30, plus there might be some members of the community coming in or out. So it was clear that it had to be a certain number. So I hope that answered the question.
And then there was a question about moving teachers who are in person. Could somebody like an interventionist or librarian be pulled to another school to teach in an in-person classroom cohort? Is the district looking at cutting interventions, ELD librarians, to cover classroom exemptions? My assumption is that people are not going to be reassigned to something they are not qualified to do. There could be a bit of shifting around, but we know ELD services are, I think they're mandated, are they not, by the federal government? Or I don't know for sure, but I think, I don't know all those answers. I'm wondering if Patty or John want to weigh in a little bit on that, because I don't think there's going to be a lot of shifting around. I think it also depends on what phase we're in. So if we're in a phase 1, totally virtual, I'm assuming most positions would stay the way they are. So I guess if nobody else has anything to offer, we'll just try to keep really monitoring that closely, because we certainly don't want people put in a position they're not comfortable with or that's not appropriate. BU teachers, yeah, are on the same contract, thank you. And what else? Let me see. So if you have a medical exemption, will your position, whether you're in your home school or other location, remain the same moving through the phases? I don't know for sure. I would hope so, but I don't know for sure.
And I wanted to answer, I think it was Courtney's questions. Yes, we made sure that, you know, there's a Latino parent council that meets, and we, believe me, the voice for the families is always there, and they are going to be part of this task force, as well as there's going to be representation from students, not the whole time, but like I said, you know, once this task force is formed, there's going to be the parameters and protocols. Those, you know, that's why in the description that you're able to go back to your cohorts and speak to the people you're representing, the educators you're representing, as well as parents are going to have the ability to do that. So there are going to be parents involved in this task force as well.
And then Barb was wondering if we can teach from our classrooms in phase 1. I think that's going to be an option, but I can't tell you for sure, Barb. I know that that's one of the concerns, you know, people had. They didn't have access to their classroom materials, and I think that was supposed to be an option for educators, but as phase 1 now gets ironed out, I'm sure that will be, but we'll certainly advocate that teachers get access to their classrooms during phase 1, because I think that's really important. Okay, I think we can move on, Nancy.
Okay, I would just like to throw out there that, you know, we have 15 teachers on this committee. The district has 15 people total that they will be bringing on the committee. And they have to make sure, we have told them, we want to make sure that we have room on that committee for community teacher or parent voices and that sort of thing. So I think really we are getting the better end of this with having 15 teacher voices there on the committee. That means they have to limit the number of administrators, et cetera, that they have.
Can I pipe in for a quick second?
Yes, Katie.
Katie.
Regarding the task force, sorry, you guys are doing all the talking here. I just wanted to say real quick, I think, I'm Katie David, by the way, I'm on negotiations and AR. The task force is also our way of being heard, and the feedback we received is that during the reintroduction phase over the summer and the late spring planning, we didn't have teacher voice on here, and now is our opportunity to have it. I think this is a real positive. And the way to approach it is that we will have more of a voice than we had prior. And that's all I wanted to say.
Katie, thank you for adding that. That is important. And I will say also that Dr. Anderson has told us in exec board meetings and in negotiations meetings that he totally owns that he did not have teachers on any committees before. And he really is very sorry that he did not have teachers on those committees. He knows now how important it is to listen to us. So I will say that he was very humble about saying, I'm sorry, I should have done it, and I didn't. Prior to students, this is safety protocols and procedures. Prior to students returning to school, BVSD will develop a written protocol for the following: circumstances under which students and employees would be subject to measures that could inhibit in-person learning, the transition to different phases, and remote learning. So they're going to have a written protocol for those 3 things. The implementation of these protocols will be discussed collaboratively between BVSD and BVEA. It is understood that these protocols may be subject to change in accordance with guidance from health departments. A matrix will be used in determining the movement between phases based on CDPHE, which is the Colorado Department of Health and Environment, whatever that is, and Boulder County Public Health Department guidelines. Educators at the building level will be consulted around the collective problem solving for the implementation of working and learning conditions that are mandated by safety and health guidelines. If circumstances require a shift to remote instruction at the class, school, or district level, impacted educators will be provided as much time as is feasible, practical, and allowed by CDE for planning to prepare. Particulars will be determined by BVSD and BVEA. And this is contract language. Referring to contract language D-2 under health examinations, a special health examination may be required whenever a physical or mental condition interferes or appears likely to interfere with the health and safety of other employees or pupils or the education of pupils. An employee may also be required to have a written report from a qualified physician showing that he or she is physically capable of doing the work required of his or her position. The costs of these special health exams shall be paid by the district. Pursuant to the above, the district will provide COVID-19 testing free of charge to all employees. Okay, that's all that's in that section. We'll answer questions.
Not seeing any related to that section yet, Nancy, unless
Okay,
I'm missing
good.
one.
Okay, going on down to teacher evaluations.
Wait.
Okay,
Somebody said the last bullet confused them.
pursuant to the above, the district will provide COVID-19 testing free of charge to all employees. That's something that the district has told us. They are entering into a contract with a nonprofit in Aurora that is going to provide testing for us once every 2 weeks. The district does have to pay for those tests, but we do not. But that doesn't mean that you can only have the tests on every other Monday or whatever the need might be. If in your classroom, someone would come down with symptoms or test positive, for example, a student might test positive and come back and tell you on Wednesday that they have, or not come back and tell you, but they would say, you know what, I've tested positive with coronavirus. You could call right then and get your name on a list and make an appointment to be tested within 24 hours. So it doesn't just have to be certain days of the month.
Nancy, I think a lot of people are questioning like the whole bullet, what's already in the contract. Can you speak
Okay.
to that? That's already in the contract?
Okay. I don't know what to say about that one. I mean, that is already in the contract. John, you want to talk about that?
Yeah, and just briefly, you know, the language in section D2 is most frequently invoked when a member of the bargaining unit has to undergo what's called fitness for duty. Sometimes it's physical, sometimes it's a mental health issue, but basically that language is invoked to permit the district to have the employee submit to a health examination to ensure that it's time for that person to go back and resume his or her duties. It becomes pertinent in this conversation because the very same language is protecting the members of the bargaining unit from being subject to unsafe conditions regarding the health and well-being of others. So we use this language in our conversations with the district to basically create a pathway wherein we were talking about the frequency with which employees get tested. So it's language that, how can I say, yeah, about 95% of the time when this language is being invoked, it has a different purpose than what we're currently using it for.
Thank you, John. Somebody questioned, we're going to talk about sick leaves. Thank you. A little further down, so we'll wait to answer that question. But no, you can't be forced to take the test. That is your choice, but it is going to be available. And I heard 24 to 48 hour turnaround. And you could be tested more often too if there is this issue of where you feel like you've been exposed, you would be able to take the test more often. And I don't think there's any discussion about mandatory COVID vaccinations because they don't exist yet.
I would say keep in mind too that with any kind of health examination or test like that, HIPAA obviously overrules or overarches all of that. So if you were tested and it came back positive or negative or whatever, your name would not be shared with anybody in the district, in your building. Only very, very few people would know that you tested positive or whatever.
John, can you just talk briefly about, there's a few questions about workers' comp, but you addressed that in the FAQs that we sent this morning, but could you just touch on it briefly?
Sure. So with any injury that you get on the job, and this would include being susceptible or testing positive for communicable disease, it can be basically paid for, the treatment can be paid for, and to an extent, your earnings can be recouped through filing a claim with workers' compensation. There are certain limits to that. You have basically circumstances where people have to file a claim within, I think it's 4 working days, if I'm not mistaken. But aside from that, my understanding is that at present, Colorado's worker compensation is insisting that employees prove basically that they got it at their job. That means that an employee who contracts COVID has to furnish evidence that supports the idea that they got their that they got COVID while on the job. I haven't verified this, but my understanding is that of those people who are coming forward and saying, I got COVID because of my job, that fewer than 1/3 of the claims are actually being honored by workers' comp. So I think that for those of you who seek to do so, and I would probably encourage it for all of you who are going to be in the classroom teaching with kids, it's probably a good idea for you to create basically the equivalent of a log that kind of documents your contacts, both inside and outside of work. Should it be the case that you test positive for COVID and that ends up having any kind of financial or leave implications for you, you could have that readily available to prove that that was the case. Obviously, if you're doing other things like traveling extensively or exposing yourself to persons outside of work who were known to be COVID positive, that would obviously undermine your case. But I think that that's probably the best thing to do going forward, is to basically log your contacts. That's about the only defense you have in terms of intersections with workers' comp.
I was going to say too, Barb Watson created a health log that is pretty cool looking, and Barb might, I don't know, Barb, if you'd be willing to share that with ARs so they could share that with their members. I thought it was a nice start to something for keeping track. And
the link that, Terry, the link that I sent you is accessible to anyone who wants to download it. So I sent it to you, and I've been keeping it since July and tracking my health on that since July. And I take my temperature every day and keep a record of that. I think we might need it.
All right, thank you. And then question about if there is a vaccine, would that change the MOU? And I think in John's FAQs, you know, he stated that the MOU can be amended at any time. So if that would be a wonderful thing to have to consider if there was a vaccine. We can only hope that there would be such a thing before the end of the year. So we definitely can amend this MOU if that circumstance would occur.
Okay, I'm going to move on. Teacher evaluations. Depending upon the future guidance from CDE, we want to ensure that the evaluation process is equitable across all phases of learning and in all manners of teaching. The evaluation process also needs to be completed in a timely manner. And again, we're waiting on a lot of directives from CDE regarding teacher evaluations. The good news is what Terry shared with us, that we're not going to have to count on 50% student growth this year as part of our evaluation. Next is substitutes. When a substitute is not available during in-person instruction, such consideration shall include not having classes or portions of classes be combined if current safety guidelines cannot be met. In the case of remote learning, educators may be required to provide class coverage for colleagues. I think, yeah, that's the only 2 bullets under that. So questions? I'll tell you that we have been told by, I'm sorry, we've been told by BVEA or BVSD that they sent out a survey to their substitutes, and many of them had said, yes, we are willing to come back and sub. They are planning to assign substitutes to buildings if we are in-person learning. For example, and these numbers are not written in stone, for example, an elementary school may have 3 substitutes assigned to their building. Middle schools might have 4, and high schools might have 5. Again, those numbers are still being worked out, and there's nothing set in stone about that, but they want to try to reduce cross-contamination and moving through different cohorts as much as possible. So that's why they want to assign people to buildings rather than have them move all across the district. And I can't see the chat, so if there are questions, you'll need to tell me, Terry.
Somebody wondered about testing even in phase 1. That's my understanding. That wouldn't go away. And then we'll talk about sick days further down. Hold on. Oh, somebody was wondering, said it's the sub coverage seems to, or substitute, a little confusing. So is it saying that classes can be combined or not?
What we're saying is if, for example, if you are teaching in person and the health guideline says that 15 people can be in your room and your next door person gets sick and they have 15 people in their room, you may not move people from your next door person's room into your room because that's what the health safety guidelines say right now, no more than 15. If you only have 4, maybe for example, in your room, it could be possible that you might move some students into your classroom with appropriate protocol, like the social distancing and the mask wearing and hand washing and all those other things. But we wanted to make sure that there was not going to be any more cross-contamination than there absolutely has to be.
And then a question about compensated for coverage. I mean, we do have contract language that talks about that already. And then covering classes for others for how long, I don't know. I think that's something that buildings would be working out. I would assume that you're not expected to, do it more than just to fill in until a sub can be procured. So I don't know. And of course, district administrators would be subbing if they need to. They started doing that a couple years ago. So yeah, I think that's the expectation, that if they're needed to sub, then they need to be available. We got some more new messages. Let's see.
Hey, Terry, this is Erin. Can you hear me?
Yes.
The comment that I was making, I feel like I should explain. There seems to be a contradiction in the bullet. Educators may be required to provide coverage. And then above, it does say, under guarantees for staff, that educators working remotely shall be granted the same caseload size protections. So I just want to make sure that our document isn't contradicting itself.
Thank you. Do we think that's a contradiction? John, do you want to weigh in on that?
I'm still following the chat thread, and so I'm just going to need a minute to respond.
Okay. All right, we can come back to that. Let's do that. Let's how about we move on to sick days, and then we'll come back to the substitute.
Under sick days, we have a couple of federal guidelines in place. The Healthy Families and Workplaces Act and/or the Families First Coronavirus Response Act. It is understood that through December 31st, 2020, teachers who meet the criteria of either of these acts will have access for up to 80 hours or 10 work days of sick leave prior to utilization of any of their own sick leave or annual leave days. Additionally, after December 31st, 2020, any other federal legislation that addresses sick leave will be in effect. The date is there through December 31st because both of those acts sunset on December 31st. So that's why we had to put the date in here. So what this is saying is that before you use any of your sick leave for anything coronavirus related, you would have up to 10 days of sick leave available to you. Now, the question has come up, if I use 10 days now, but I find out that I have to quarantine again down the road for 14 more days or 10 days or whatever, can I tap into that again? And the answer is, unfortunately, no. Once you use the sick leave from either of these two acts, you have used it, and then you would go on to your own sick leave. The district is committed, again, to, of course, we always do this at the beginning of the year, opening up the sick leave bank. So that will be reopened for us. They did that last year in March when we started on home learning. And I would encourage you to, if you don't belong to the sick leave bank, it costs you 1 day of your leave to join. And then if those days start to get depleted, they may come back and ask for another day. But we're also kind of in some talks with them about how to possibly add more days to that sick leave bank as well. So I'll let someone else chat or talk.
I think you covered that really well, Nancy, that section. And so we're expecting that there could be more legislation once that Families First Coronavirus Act expires on December 31st, take the place. So I just want to make it clear too, if you know, back when we were thinking more of phase 3 or 2 with in-person in some form or fashion, just because you're quarantined, it doesn't mean you can't keep teaching. So you wouldn't lose time. You can still teach remotely if you're quarantined. If you're quarantined and sick and can't teach, then that would require you to use some form of annual leave or sick leave days or the sick leave bank. And then we can go back to substitutes. So Erin, why don't you come off mute and explain your concern again, just so we can make sure that we fully understand what we need to clarify here.
Okay, all right. Can you hear me okay?
Yes, thank you.
Okay. Yeah, the second bullet under substitutes says, in the case of remote learning, educators may be required to provide class coverage for colleagues. That kind of, to me, depending on timing, may include a larger caseload. Because, for example, at elementary level, we, last spring, for example, we kept the same kind of schedules. So in order for me to help a sick colleague, that would not be protecting that size protection, even if it's a remote learning situation. Does that make sense?
Yeah. So my assumption here, and this is from what I remember of our discussion, this would be kind of an emergency type of coverage, such as happens now. And if there was going to be any kind of like somebody is ill for an extended period of time, there would have to be a substitute provided. It wouldn't be like you're taking on you and a colleague's class for days and days. So I think it's, anyway, that's my response. And maybe someone else who was involved would like to add more clarity to what I just said.
Sure, Terry, I'll add something. Sorry, Nancy.
It's okay.
So, yeah, so what the district has been working on is they have secured and spoken with about 350 to 400 substitutes that are going to be trained and willing to step in, whether it's in person or online. So because of the complications of which, it depends which phase we're on and how many cohorts one person can have contact with. So how many groups of people in one day you can have contact with. That's how a lot of these phases are determined. We're learning a lot from Boulder Public Health, is how it happens. So the goal is to have a certain number of, I would call them in quotation marks, permanent subs for each building. So for example, don't like quote me on the exact numbers. Let's say an elementary school will have 3 substitutes assigned, a high school would have 7, for example. And those would be specifically for that building. So those substitutes will not have to go from building to building because of this restriction of how many people you can be in contact with in one day. So if it's in, the same thing would apply online. So if a teacher, you know, gets sick and they have to be offline because they cannot take care of that from, you know, working from home, then a substitute would be a long-term sub for, you know, however many days he would need would be assigned to that. So they are working. I know professional development, Katie Mills has been working extensively on that and how to train the substitutes in all our systems. So I know that's a big conversation. And also I really wanted to add, because I know this question, I know it has nothing to do with this, but since I have the floor, there's also going to be PD for parents going into this, and it's going to be offered in Spanish and in English for parents to, you know, help them navigate the situation online with their student at home. So that's another big piece that the professional development is working on.
I was going to add to this also, Patty, that Erin, to answer your question a little bit more, also, you know, when you take a class from someone else, you are paid to do that. Our contract covers that. It's not necessarily adding to your caseload. And again, it would be a temporary thing. And adding to what else Patty said, you know, they, I think they have told substitutes they're going to guarantee them 3 days of work per week if they sign on, and they're going to pay them the maximum rate of $140 a day for those 3 days. So I think that was used as incentive also to have substitutes, because, you know, we all know in non-pandemic times, we didn't have enough substitutes. So we have questioned and questioned and questioned the district about this because, you know, of course, we're skeptical that we're going to have enough subs to cover all of this. And those are 2 of the things that they have said that they will do: guarantee $140 a day and guarantee 3 days a week work for them. So at least that's a plus, I guess.
Thank you for that, guys. I just wanted to make sure we weren't contradicting ourselves in the language. Thanks so much.
Oh, thank you, Erin. And also I wanted to add, I know there's a question about parents and how parents are being communicated. I know the community partnerships has been very involved in all this work that's been done through the summer, and the Latino Parent Council has been extremely involved in everything the district is doing. So I know that communication doesn't just go out via email, it's also going out via text information and other forms, and information is also going out in Spanish. So I really want to assure all of you, you know, that are in bilingual schools and working with ELD students, that anyone on this board can tell you that I am a huge advocate. I am, you know, the #1 person that continually brings this up, and I really want you to really know that, you know, the voice is always there about our Latino families.